Okay, so I chose to do my topic on portal hypertension. What is portal hypertension? Portal hypertension occurs when blood flow through the liver is reduced or blocked entirely and backs up. This causes large distended veins to develop in the esophagus and stomach. These can become fragile and rupture, leading to bleeding in these tissues. Most often, the contributing factor is cirrhosis and the consequent reduced blood flow in the liver. Some symptoms. Patients with portal hypertension most commonly exhibit hematemesis from ruptured varices. However, there are several symptoms that are more definitively diagnostic. Splenomegaly, defined as greater than 12 centimeters in caudocranial length, is indicative of portal hypertension. Additionally, there may be distended veins in the abdomen running up the chest from the navel as blood is shunted from the para-umbilical veins to the caval system. Other symptoms include those associated with the most common primary cause, cirrhosis of the liver. These include abdominal pain, jaundice, an increase in the amount of breast gland tissue, palmar erythema, ascites, pedal edema, as well as the loss of motor control over certain body parts. How is it diagnosed? So, lab results will show thrombocytopenia secondary to splenomegaly and anemia from gastrointestinal varices bleeding. A metabolic panel may show signs of renal failure, elevated liver enzymes, low levels of serum albumin. Though not required to make a diagnosis, Doppler ultrasound is often utilized to visualize the portal vein and evaluate for stenosis or thrombosis. Measurements can also be taken of the size of the spleen and the portal vein. Treatment for portal hypertension secondary to cirrhosis of the liver can only effectively be had through a liver transplant. As hypertension in this case is a result of a primary causal factor, treatment of the underlying obstruction is also necessary. The degree depends on the amount of blood flow to the liver, the size of any dilatated vessels, their risk of rupture, etc. Balloon angiograms and/or stents may be placed. Severely dilated vessels that are determined to have a high probability for rupture may be ligated, and the patient may benefit from starting a beta blocker. Antibiotics may also be employed in the event of inflammation and subsequent infection. So the prognosis depends on the severity of the hypertension and the resulting damage to vessels and organs. As most cases of portal hypertension are caused by cirrhosis of the liver, if left untreated for a significant amount of time, the patient may require a liver transplant. Assuming that they seek medical attention early, as soon or before symptoms present, the interventions to restore blood flow may be able to reverse tissue damage, leading to a better prognosis. Depending on the extent of repair, such as stents, bypasses, etc., the patient may require more or less follow-up treatments for various complications. So I was really interested in portal hypertension after my wife and I visited London and the National Gallery, and we saw some paintings from Leonardo da Vinci, and I picked up a book on his anatomical sketches, and I was reading it the other night, and I came across this illustration that, upon reading the translation, depicts what may have been the first person, or it may have been the first illustration of a patient with portal hypertension. So sometime in the winter of 1708 to 1709, Leonardo da Vinci dissected a man who told him he was over 100 years old before he died. Anatomical Manuscript B contains his notes on this centenarian with a sketch showing a grossly enlarged spleen and describes the occluded blood flow and its effect on the distal tissues. So these are his words upon dissecting this guy. The artery and vein which in the old extend between the spleen and liver generate so thick a coat that it closes the passage of blood from the mesenteric veins, through which blood passes to the liver and heart, and to the two great vessels, and thus through the whole body. And these veins, as well as thickening the coat, grow in length and become twisted like a snake, and the liver loses the humors of the blood which was carried there by the vein, whence the liver is desiccated and becomes like congealed bran, both in color and substance, so that when but a little friction is made upon this substance, falls away in minute particles like sawdust, leaving behind the veins and arteries. So I thought that was super interesting. I read about this and thought it was worth researching, and that it was super cool.